Research Podcast. I'm your host, Dr. Ren, founder of Diverse Research Now. And today you will hear the voice of someone very dear to me, my sister, Elisha Butts. Elisha is a clinical research professional, just like her sissy, with over 13 years of experience. She began her career just like me as a research assistant in Alzheimer's disease research and is currently working in study startup. This episode is part 2 of our Inclusive Research is a Family Affair. Part 1, you all met my hubby, and now you get to meet my sissy. So let's get started. How are you doing today, sissy?
I'm good. Hi, everyone.
How was your day today?
It was good. I was off, so.
Oh, good. Good.
Yep,
It's
had
nice
to.
to have a day off.
Yes, had to
I know
get the
you're
kids.
busy.
Yes, 3 babies.
Study startup is a busy part of research.
It is, yes, but it's fun. I enjoy it. I'm not in the field or anything. I'm kind of on the back end of things, but yeah, it is very busy, very
Yeah,
busy.
it's busy work, I feel like. So you're like, you probably never feel like you're caught up.
No, I'm so. I went on break for 2 weeks, holiday, and I feel like I'm still trying to catch up and we're in the new year. So yes, definitely.
Exactly. So yeah. But anyway, tell the people who you are. Tell them a little bit about how you got into research. Let them know why this is a family affair.
Right. The question is so funny because I get this all the time when interviewing. My story is I got into research because of you. I came out of college and I needed a job and I just kind of fell into it and started to enjoy it. What I loved about it was more me and you, we worked at Rush. I was a research assistant and in the Alzheimer's department. And so I enjoyed working with the participants, just seeing them on a yearly basis and, being that friendly face, just being relatable to them was enjoyable. So that is how I got in.
Did you have some of the same experiences I had when we were both out in the community a lot?
Yes.
Right?
A lot. When everywhere, every part of Chicago, I was.
We had the opportunity, really the pleasure to go into seniors' homes. And a lot of them were Black seniors.
Yes.
We were able to go into their homes and do assessments with them.
Yes.
That was one of your favorite parts? Because it was one of my favorite parts as well.
Yes, I definitely love that. It was just easy. I loved about it with just being able to do my own schedule. And I loved how they would request me. And I'm like, yeah, come out. I would be your research assistant or your person or what have you for the trial.
Yeah.
But yeah, it was nice. Yeah, I love that. I definitely
loved us, right? Like, I think that they really enjoyed having someone to come to, even though we were doing assessments, a lot of times they would take the opportunity to talk to us, share about
buy us dinner.
lives.
Yeah. I said, buy us dinner. Like, I would always be like, oh, could you come down? Could you come to lunch and do this? And then I'm like, okay, I think I may have time.
Wow. No, I don't know if I ever got nobody buying me dinner. Now, you didn't see, they didn't like me as much then, I guess.
Yeah.
You had someone buy you dinner?
Yeah, they wanted, because sometimes, depending on where they are, the senior homes, not everyone had like houses. So you would have to go to the community homes or what have you. And then they had like dinners downstairs. And so they would treat me on their credit or whatever. It was really nice. They were very friendly. I enjoyed it. Free lunch.
Yeah, right. Exactly. So what made you want to stay in this field? Because I mean, you had opportunity. You were very talented. My sister is very talented, guys. She is a designer. But what made you want to stay in this research field?
Well, I started to appreciate it even more just each year, knowing that I'm helping people. It really was truly a help because sometimes I would see people where they wouldn't even have family that would like see them. So it was really nice to know that I was that person that they would literally look forward to the sessions with me. And I enjoyed that, like just to be able to put a smile on their face and just, like I say, a friendly face. I enjoyed that.
And so you sat on Diverse Research Now board for a little bit as a help to me.
It did.
Very beginning, she is actually one of our founding board members, people, because we are so dedicated to this work. She wanted to work and do the community engagement work as well, because as you can hear, we both are so dedicated to our community. So tell me, what are your thoughts about the field now and how much the attention that diversity is getting in the field right now? I'm sure you probably think like me is overdue, right? The attention that it's getting.
Yeah,
Tell me
definitely.
your thoughts about that and what your experience has been as far as hearing about diversity in clinical trials.
Oh, I definitely think it's very important. Just even now, how things are today, it's definitely important. You see all types of ads, the different articles on how clinical trials are starting to help when people of color or in certain ways. And I think there was one article I think I had read about like blood pressure or what have you, and how it wasn't as effective for us people of color depending on like the trial that you're in. So it's so important. But I'm not in the field as much now. Like I'm a coverage analyst, so I am part of the study startup, but I'm more a part of how we're funding these trials and how we're getting these trials to the start to where they can start recruiting patients. And I'm in the pediatrics department. And it's so interesting because adults in pediatrics, they're totally different in when it comes down to clinical trials. And when you think of diversity, you don't really think of that with children. And I do feel that it's more needed as adults, but with kids, you have that diverse there. And it will be nice to kind of have that trickle down for more adult trials.
Okay, wait a minute. So your experience, you've seen that there's diversity in the participants when it comes to the pediatric studies.
Well, it's not about more like your race.
Mm-hmm.
I would say I feel like they targeted more like the gender and age more.
Okay.
But I do feel that it's just something you just don't think about it because you want to help every child, right? So
Yeah.
I feel like that should be the same way with us as, with adults, with the adult trials. You want to help every adult.
But do you think that people are, because we definitely don't exclude the children at Diverse
Mhm.
Research now. I mean, we just had our annual event. At all our events, we have a kids corner because we do believe in educating the children as well. And we believe in educating the whole family, not just the participants that we want in the studies, the whole family. It is really a family thing, and we have to include everyone. So, but I always thought that when it comes to children, that would be a hard thing. And I don't know that much about pediatric studies, but I feel like it's hard to recruit. It could be super hard to recruit for pediatric studies because people don't want their children to be getting a drug that maybe not be approved. Have
Well,
you?
I think it's the opposite.
Oh,
Yeah, I definitely think it's the opposite. No, we definitely have had a lot of trials come our way, and a lot of patients or a lot of parents, I would say, are very much involved. They want to help their child as much as they can, help and learn about diseases and their disease and what they can do or what is out there that is an option to better the life of their child. So I definitely think it's the opposite. I definitely think parents are more willing to
yeah.
have their child participate. It is a family affair. So you definitely have to have the parents on board as well as the child. But I think when in pediatrics, there's a certain age limit. So I think I want to say 12 or something like that, where they can then start to decide if they want to be on a trial or not, and not always have to have that parent consent.
Ah, okay. Okay. I think that's so interesting to hear. And I love that you brought that out because we do want to break down the stigma of clinical trials all around. So we want a community to know there are trials that children can get involved in, and we need the children to get involved of all backgrounds,
Mhm.
and that it's not something you have to be afraid of,
Yeah.
that these trials are necessary in order to discover medications that are going to help our children that might be sick, or even just, of course, I'm sure you need healthy volunteers in pediatrics too. So It's great to consider. I actually have soon, we're going to have a young man come on who is a kid and he was in a trial. He's going to tell us about his experience. I can't wait for that episode. But that's going to be so interesting to get his take and hear his voice on his experience in the study. I think it is definitely something we don't want to exclude the kids. They're super important to have them included. So important to bring up in this conversation. Tell me what you want the pharma to know when it comes to clinical trials. Do you have any advice on how they should approach, like even with your work with the study startup? Is there anything that in study startup that you just always have wanted to share with the sponsor that would help you in your work or help us to get, studies started up a little easier maybe in the community when it comes to pediatrics? Anything that comes to mind that
I would just say making it more accessible for all. I know a lot of people just in general, just not even just in pediatrics, you think about how much is this going to cost? Because clinical trials, the trials, they're not fully free, right? So you're using insurance and so forth. So I definitely
wait, because I thought that clinical trials most of the times is free to people. So are there trials out there that where you have to use your insurance?
Well, yes, my experience in pediatrics, yes, we do. Because as a coverage analyst, that's my role. I review protocols and the procedures that are involved in the protocol. I determine if these procedures are either going to be billed to insurance or if it's research.
Now, can you give me an example of something that would be billed to research and what would be and something that would be billed to insurance in the pediatric study?
For example, if it like physical exams, it depends, right? And I feel like they kind of try to work or design the trials around the person's or the child's disease or what have you. If they're coming in on a regular basis for like clinic visits, then most likely that's going to be billed to insurance.
Oh, so standard of care. That's their standard
Right.
of care.
That'll be standard of care billed to insurance. And if it's something that they wouldn't be coming in for, if it's like a day that they don't really see the doctor on that day, then that would be more of a research charge.
Okay, but they do have to sign like consent or
They do.
assent for
There are consent.
and then in that assent or consent, it should lay out everything that's a part of the research study.
Some consents, yeah, they do. Majority consents, they break out what would be research and what would be the child's standard of care.
Ah, see, and I don't know much about pediatric studies, so maybe it's a whole different
I
world.
think it's different. I definitely do think it's a whole different world, but it's interesting. Yes, it is. I do think it has a lot of moving parts to it. But yeah, I do think it is from what I'm used to at Rush, it was more adult trials than pediatrics. So
Okay, so do you think that which one would you prefer? Do you prefer working with the adult studies or like the pediatric studies?
putting me on the spot. Okay. No. No, I enjoy the pediatrics part of things. Just reading up, it's so interesting when reading these trials, the different diseases and how these different medications can help, and affect even just medications that are already on the market, how they're like retesting and
Right.
so forth. They can have a drug on the market that they test in adults and it can work fine in adults, but then now they're testing it in children. So that's where the differences come in at. So yeah, it's nice. I enjoy pediatrics.
And so I know my sister has three little itty bitties,
Yeah.
my two nephews and a niece that I love very dearly. Their children. Would you be open to them being in a trial? Would you be open to that? Just personally.
I don't know. That's a good question. I guess it would just depend. It depend on the trial, depend on the things that they would have to go through. Would it be something that would completely uproot their normal schedule, or would it be something that typically something that they normally are doing and it really wouldn't affect much? Just example, how I gave with like the physical exam or something. If they're coming in anyway, maybe. So yeah,
At
I'm kind of
part
on and off with it.
already doing. Yeah.
Yeah.
I totally understand that. I was just asking that question because I'm sure that's always in the back of my head is that with parents with small children, I always think that that's probably many parents probably don't want to get their kids involved because, hey, their kids are probably already doing so much. That might be a
Yeah.
big barrier to pediatric studies. But I guess if your kid is actually getting help and actually they're studying a medication that could actually help them, then you'll do it. So,
Mhm. Mhm. I agree.
okay. Well, thank you so much for talking to us today. I really
Yeah.
appreciate your voice.
Thanks for having me. I
And
was nervous.
no
Nice.
reason to be nervous. This is a family affair. I appreciate your work that you're doing in this field because, hey, we're going to make a difference together. And I love that I have family that is supportive and is willing to do this work with me. So thank you so much.
Yes, yes. You're welcome, Sissy. Thank you.
Take care. I'll talk to you later. Yes, guys, me and my sister are on different time zones. She's in Chicago. I'm in LA. And so she is about to probably head off to night, put the kids to.
Yeah.
But
Door.
thank you so much for making time for this, for the podcast. And again, I appreciate your voice.
Oh, you're welcome. Thank you.
All righty. Bye bye.
Bye.